There's more and more research suggesting that those first few days, weeks, months of life are really critical for health outcomes and other outcomes throughout the whole of your life. So I do think that we need to prioritise new babies and their families and put more resource into that and make sure it's available to everyone, regardless of your postcode. I'm a paediatrician and a breastfeeding specialist. I developed an interest in breastfeeding medicine mainly through my own experience in my work at Starship EDs. And I'm also a mother to 3 boys. Basically had a full house of breastfeeding issues with them. I really didn't find the standard of care that I wanted for myself. There wasn't good specialist evidence-based information available to me. Went back to Children's ED for a bit and I was noticing there were women coming in with similar issues to the ones I'd had. So I decided to undertake some training in that area. So I went and did my lactation consultant training with one of the other consultants in the emergency department. And then we tried really hard to lobby the hospital to increase breastfeeding services and fund a specialist service effectively. But funding constraints and priorities meant that after years of trying to campaign for this, we really didn't get anywhere. So then I felt I had some expertise and I'd reached a roadblock with the ADHB. I opened up a small private clinic seeing women with breastfeeding issues and other types of issues related to babies. So women are left often having to pay either private lactation consultants to come and help them or to come to a clinic like mine, which is expensive. This summer I supervised 2 medical students one of whom was looking at DHBs around the country and looked at what sort of breastfeeding support they were offering in the community and in the hospital.
There were significant disparities in the amount of support available and also the duration of time that it was available for. One DHB didn't provide any directly employed lactation consultant in the hospital, whereas most of them did, but the amount that they did employ them for varied significantly as well.
This summer I spent my time researching with Dr Abby Baskett on the clinical breastfeeding education and clinically relevant health science degrees in New Zealand. Over 60% of programs taught less than 4 hours of breastfeeding content across the entire degree. At the end of the day, all these students will end up as a healthcare professional working in clinical practice, so the education should reflect that, and it isn't currently. Some
DHBs only cover babies up to 6 weeks and then they stop all breastfeeding support, others to 9 months. Some have community outpatient services, some don't. Depends which hospital you're born in, how long you'll be entitled to breastfeeding support and how much support you'll get. I really appreciate that MAS funded these research questions because they're really important ones that we needed to answer. If you don't get what you need from your initial healthcare provider, such as your midwife or plunket, or when you go to your GP for extra health, it would be almost impossible that you would find your way to a clinic such as mine. And what I'd really like to see is that there was a small clinic availability for all women funded, preferably through the DHB or through another organisation, so that I could make that kind of care available to women in other postcodes around Auckland.